The Heroi Cuidador is a solution that prevents the pain of the elderly caregivers.
Dementia is a degenerative disease with no cure, affecting 10 million people per year, according to the World Health Organization. As the disease progresses, they will need the help of a caregiver to perform their daily activities, such as putting on clothes, walking, bathing, or eating. The caregiver must know how to perform the correct movements for each activity to ensure safety for the elderly and for himself. Performing the wrong movements also brings risks to the patient's health. The lack of stability in the movement can lead to falls and contusions, one of the main causes of elderly's hospitalization. Not only that, but a wrong executed movement can overload the caregiver's lumbar region, which ensures stability and provides support for the execution of the needed movements. The caregiver believes that he already knows what he's doing and end up neglecting the correct movements. Thinking about them, our goal is to be with the caregiver, evaluating and monitoring their posture during work, performing interference when there is an overload of the lumbar muscles, inactivities, or bad position. This way, they have their health and the elderly safety guaranteed, providing quality of life for both. Heroi Cuidador is a wearable located on a belt measuring all the muscle activity of the lower back and the angulation of the spine discreetly and accurately. The system needs to be in the caregiver's body for not only sensor measurements but also for a better perception of the vibrating feedbacks. The system consists of the collector device and then mobile app. The collector device is subdivided into a sensing, processing, communication, and feedback modules. The sensing module is responsible for measuring the activation of the muscle in the lumbar region and the inclination of the caregiver's spine. After the data is collected, the processing module analyzes whether the user is in need of a postural correction or if the muscle is subjected to an effort greater than its capacity, that is, fatigued. If either of these two scenarios occurs, the processing module sends a command to the feedback module that will signal the caregiver that the movement is being carried out in the wrong way. In addition, the communication module sends the collected data to the mobile app. In the app, the caregiver can interact with the collector device by giving commands to switch between the calibration and operation modes. In addition, they can view the performance on the workday by viewing the graphs generated from the data collected by the system, making the caregiver not only improve his work but also not develop complications in the spine and lumbar region. In order to increase the accuracy of the analysis of the caregiver's activities, the system has a calibration mode that works as follows. The user selects the calibration mode in the app, which sends the command to the collector device to enter calibration mode. Once started, the user is instructed to perform a series of exercises while the sensing module collects the respective data. At the end of each exercise, data is sent to the app. After completing the exercises, the app performs the necessary calculations to adapt to the user's biotype and sends the caregiver's information to the collector device. At the end of this process, the system is ready for use. This makes it possible not only that the data analysis is more accurate, but that the device can be shared between different caregivers. The sensing module consists on two sensors, the electromyography myaware that is used to identify the muscle activity and the MPU 6050 that is responsible to measure the inclination and acceleration of the user's spine, what helps us to prevent the caregiver from doing movements beyond the expected. Prototype processing module is the Arduino Nano, which processes data collected from the sensors and analyzes if there is muscle fatigue or if the caregiver is doing the wrong posture for the activity. If the processing module indicates the wrong execution of the movement, it will activate our feedback module, the motor VibraCall MV50, which is in contact with the caregiver, giving continuous and discrete signals when activated. As Alzheimer's patients have some behavior changes, we cannot use sound and light signals for the feedback, and it needs to be felt only by the caregiver. Our Arduino 8C05 Bluetooth sends the received data to the cell phone, where the caregiver will have visual information on how he's doing his daily activities. We not only use low-cost sensors compared to the market, as we have a specific product to our market fit. It can measure different movements done through the workday. It does not limit the caregiver's movements and can easily be used by many caregivers at once.
Our goal is to care, evaluate, and teach the caregiver the best way to carry out activities with the elderly. Be on their side to remind the correct movement, avoid future complication, and guarantee an improvement in the quality of life.